Can you identify this specimen? This is a nasogastric tube. Commonly passed the nasogastric tube through the nose and it goes to the stomach. Now, different sizes of nasogastric tube are available and there is a color coding for that. At the tip of the tube, 1 centimeter above the tip, there is an orifice, lateral eye, through which you can give feed. And inside there is a radiopaque line. The benefit of it is when you do X-rays, you know the position of the nasogastric tube. Color coding for size identification, which may be useful depending upon the age and the size of the nose and so on. And in the nasogastric tube, there are markings to tell you where exactly the tube has gone to. And there is a drainage port with the lock at the tip of the nasogastric tube. There are different types of nasogastric tubes made up of polyvinyl, silicone, and polyurethane. What are the common indications to use this tube? When there is obstruction, you can suck out the secretions or whatever is in the stomach and deflate it. When you want to give drugs, the patient cannot swallow, this is a good route of administration. Whenever you want to feed someone who is unconscious, who is not able to swallow because of neuromuscular diseases, again, you can go for enteral nutrition. And of course, for lavage of stomach, also this may be used. Are there any contraindications for use? Stricture is a basic contraindication. Basilar skull fracture, again, it may go into the skull, so it is relatively contraindicated. So also facial fractures. People who have consumed acid, the conventional teaching is not to pass nasogastric tube, it may produce perforation. But there is a different view that immediately after taking the acid as a poison, you may pass a tube before the esophagus becomes very friable. That's a debated point. And there is no contraindication for passing an nasogastric tube in the presence of esophageal varices, as in cases of cirrhosis of the liver. And there is no contraindication to use this tube when there is a bleeding diathesis. If are there any contraindications for use? Definitely yes. Perforation and reflux disease, this is better not to be used. And as I already told you, acid poisoning is another serious situation where you may induce perforation when you pass this tube.